So your child needs a MACE procedure or Malone antegrade continence enema. This is Betty Ann Thibodeau, pediatric urology nurse practitioner at the Stollery Children's Hospital. The MACE tube will be inserted under a general anesthetic. Your child will be in hospital for 4 to 7 days, depending on how they are doing. Before your child is discharged, you and your child will be taught how to care for the MACE at home. To learn more about what to expect on the day of your child's surgery, go to the Stollery website and search Your Child's Surgery. Immediately after surgery, your child will receive pain medication through their IV and by mouth. Your child may have pain throughout their belly and along the incision. Over time, the pain will become less and your child will be switched to oral medications before going home. Once at home, the mild pain may continue for a while. Over-the-counter pain medications may help relieve the pain. Speak to your pharmacist if you have any questions about your child's pain medications. The bowels normally contract and relax in waves to move food through the bowels. After surgery, the bowels usually stop working for a period of time, and it can take a few days for the bowels to wake up and start moving again. Some medications may slow the bowels down as well. Your child may not have much of an appetite, may be unable to pass gas, may have some nausea and vomiting, and the belly may get distended or bloated. If your child has a lot of vomiting, your child may need a tube inserted through the nose into the stomach to drain the stomach until the bowels start working again. Usually when the bowels begin to work again, your child will have a lot of crampy pain. Getting up and walking around will help the bowels move and relieve the discomfort. A MACE or Malone antegrade continence enema is a surgical procedure which uses the appendix to make a channel into the bowel. This channel allows you to flush a large volume of fluid through the bowel to clean out the bowel. It is a different way of giving an enema and helps reduce or prevent bowel accidents. The MACE procedure is done under a general anesthetic. A small opening or stoma is made in or close to the belly button. A soft plastic tube or catheter is inserted into the stoma to keep the channel open while it heals. This tube allows you to flush the bowels or give daily enemas. During the surgery, a one-way valve is made out of your child's own tissue to prevent stool from leaking from the channel. Your child is able to bath, shower, or swim, or participate in water activities with their MACE. The temporary MACE tube is inserted into the stoma through the appendix into the bowel during surgery. The tube is stitched in place to prevent it from getting accidentally pulled out. The tube stays in place for at least 3 weeks to allow the channel to heal. Special securement devices and/or medical grade tape also help to hold the tube in place. Once your child is eating and tolerating food, you will start to do flushes through the temporary MACE tube. Any bandages over the incision and temporary tube are usually removed before your child goes home. To prevent infections, it is important to always wash your hands with soap and water before and after any tube care. Your child may shower or bath while the temporary tube is in place. Gently wash the skin around the incision and the tube with warm soapy water. Gently remove any crusted areas around the tube. Pat the skin dry. Apply antibiotic ointment around the tube site with a cotton swab. Do not use any powders or lotions on the skin around the tube site. Check the incision and MACE tube site every day for any signs of infection. It's normal to have a small amount of redness around the tube from the tube rubbing against the skin. The incision and MACE tube can be left open to the air, do not need to be covered with bandages. Once your child is eating and tolerating a diet, you will begin to flush the MACE. It is important to flush the MACE every day to keep the bowel empty. The flushes are usually started through the temporary MACE catheter while your child is still in hospital before your child goes home. You will follow the schedule listed on the following page. To begin the flushes, you will need to gather your supplies. You will need a 60 ml catheter tip syringe or a feeding bag. The appropriate amount of warm, not hot, water. Before you begin the flushes, your child should be sitting on the toilet. For the first few flushes, you will use a 60 ml syringe, and when you're flushing a larger volume, you will switch to the feeding bag. You'll likely not see much for results until you're flushing with a larger volume. This is the flushing schedule you will follow. As you can see, you will increase the flush volume by 30 ml every 3 days. Initially, you will use a 60 ml catheter tip syringe to do the flushes. Your child should be sitting on the toilet before you begin the flushes. You will likely not see much for results until you're flushing with a larger volume. Fill your syringe with 50 ml of warm water. If you're using well water, boil the water first and allow it to cool before using. You can also use distilled or bottled water. Remove the catheter plug from the temporary MACE tube, insert the syringe into the end of the temporary tube, and flush the water through the tube into the bowel. Remove the syringe and put the catheter plug back in the end of the MACE tube. Wash your equipment with warm water and soap. Allow to air dry. This is the kangaroo feeding bag. Before you begin, ensure the roller clamp is closed or the water will run out onto the floor. To use the feeding bag, you will lift the lid, pour the appropriate amount of warm water through the top into the bag. Squeeze the drip chamber so that you get some fluid into the chamber. If you do not fill the drip chamber, you'll get a lot of air into the tubing while doing the flushes. Open the roller clamp part way to slowly fill the tubing with water. Close the roller clamp once the water reaches the end of the tubing. Hang the bag high above your child on a hook behind the toilet or on an S-hook over the shower curtain rod as the water flows by gravity. Remove the plug from the temporary MACE catheter. Attach the tubing from the feeding bag to the temporary MACE catheter. Slowly open the roller clamp halfway to allow the water to flow down into your child's belly. As your child becomes more comfortable with the flushes, you may be able to open the roller clamp to speed up the flow of the water. Some individuals can tolerate the roller clamp being wide open. If your child becomes crampy with the flushes, slow down the flow rate by adjusting the roller clamp. The whole process should take 45 to 60 minutes. If there's no water flowing, try hanging the bag higher. When finished, wash your equipment with dish soap and water and allow the feeding bag to air dry. You can continue to use the same feeding bag until the bag starts to leak or no longer works. The volume of warm water required to flush the bowels is different for everyone. Use the flushing schedule to slowly increase the volume of water and find the right amount of water for your child. Your child may need more or less volume than what is recorded on the schedule. You will know you have the correct volume when the flushes are completed in 45 to 60 minutes and your child does not have any accidents or staining in their underwear for 24 hours. If your child complains of cramping with the flushes, adjust the flow rate to slow down the flushes or decrease the volume you are flushing. It may take some time to find the correct volume and flow rate that works for your child. Some ways to make your child more comfortable during the flushes includes using a step stool or squatty potty under their feet so their feet aren't dangling. This may also help your child with emptying their bowels. Using a towel or blanket on their lap for warmth, as well as a small pillow behind their back for comfort. You can set up a small table in the bathroom for your child to do their homework. Some children will also watch TV shows, watch movies, or play games on an iPad to pass the time during their flushes. Sometimes your child may have some mild discomfort from the incision or the tube site. Use over-the-counter pain medications as directed. If you have questions about the pain medications, call your pharmacist. If the pain medication is not working and the pain is getting worse, call your doctor. Your child may also have some minor skin irritation or redness around the tube. This is perfectly normal. If the redness around the tube is getting worse, hot to touch, and spreading out from the tube, call your doctor. Sometimes you can have tissue that bulges out around the tube or called granulation tissue. This is normal and can be treated in the clinic if it is bothersome. These are pictures of normal redness around the tube as well as granulation tissue. Call if your child has any signs of infection around the incision or MACE tube site. Signs of a wound infection may include irritated, swollen, red or tender skin, redness that is spreading out from the incision or tube site, pus from the incision or catheter sites, the incision is opening up, increased pain around the tube site or incision, as well as a fever or general feeling of unwellness. Call your doctor or Betty Ann if the MACE catheter has fallen out, there are signs of infection around the tube site or incision, you are having a hard time with the flushes at home, or you're having difficulty managing your child's care at home. Call your doctor or you can contact Betty Ann at 780-407-7010 Monday to Friday during the day. You will need some supplies to care for your child at home after surgery. You can either purchase the supplies from a healthcare store, your pharmacy, or online. You may need to go to more than one store to purchase the supplies. For your convenience, you may purchase a Care at Home kit from the hospital. This kit will contain the supplies you require to care for your child for the first few weeks at home. This package must be purchased before your child is discharged from hospital. Please let your nurse know if you require a Care at Home kit. This is a list of supplies your child will need at home after surgery. The tube in the MACE channel is usually removed approximately 3 weeks after surgery. You will need to book a follow-up clinic appointment for the tube removal. If you do not have an appointment booked when your child is discharged from hospital, call 780-407-1980 to book a follow-up appointment for approximately 3 weeks after your child's surgery. The temporary MACE catheter will be removed by your doctor approximately 3 weeks after surgery. During the appointment, you and your child will be shown how to insert a catheter into the channel so that you can continue to do the MACE flushes at home. To flush the bowels once the temporary catheter is removed, have your child sit on the toilet before you begin the flush. Lubricate the catheter with a water-soluble lubricant and then insert the catheter through the stoma into the bowel. Flush the water through the catheter using the kangaroo feeding bag. Once you finish flushing the water into the bowel, remove the catheter. Your child should remain on the toilet for 45 to 60 minutes or until the bowel is empty and there's no longer any water or stool flushing into the toilet. To flush the bowels through the stoma, you will insert a urethral catheter into the MACE opening and then attach a kangaroo feeding bag to do the flushes. Sometimes the MACE opening can become tight over time. If you're having difficulty inserting the catheter through the MACE stoma because the opening has become tight, you insert a catheter into the channel and leave the catheter taped in place for a week to stretch the opening. To prevent the catheter from leaking, you can plug the end of the catheter with a catheter plug or tie a knot in the end near the open end of the catheter. If you use a knotted catheter, you will need to remove the knotted catheter, insert another catheter into the channel to do the flushes, and then reinsert the knotted catheter after you're finished the flush. This video was made to help you care for your child at home and made possible with funding from the Stollery Children's Hospital Foundation.